My name is Mary King. I'm a care coordinator for ALS United Rocky Mountain, and we will make sure we leave time for questions in the end. So it is okay to just type a question in the chat box if you would like, and then we'll make sure we address those questions at the end of the presentation. And we are very excited to be joined by Jen, a physical therapist assistant with over 30 years of experience working with individuals with neurological conditions. Through her work with PAM, she supports patients transitioning from home and brings practical, real world insight into mobility, safety, and day to day care. We're also joined by Dustine, PAM Rehab's Director of Outpatient Marketing, who helps connect patients and outpatient services that improve outcomes and support aging in place, ensuring continued care and access to helpful resources. So, Jen and Justine, I am going to pass it over to you.
Thanks, Mary. Thanks for the warm introduction.
First off, we just want to introduce what PAM is. PAM is an inpatient rehab hospital, and PAM stands for post-acute medical. I'm a clinical navigator for both PAM Westminster and PAM Golden, and Dustine covers both hospitals as well.
With a focus on our outpatient services. So when they get the great inpatient services here at either of our hospitals, then if they need additional support, or perhaps even what we lovingly like to call a tune-up, then they can come into our outpatient hospitals and have the most advanced technology and the most therapists that are right there because they are part of our hospital system. So it's a really elevated level of care for our outpatient services as well. So today we're going to go into a presentation. I'm going to go ahead and get our screen up and ready. Let me just ask, has anybody, take off your microphones for just a second, unmute yourself if you have. Has anybody had a family member or a neighbor, a loved one that has used PAM before? Are you familiar with PAM Rehabilitation Hospitals, Golden and Westminster? We actually have two other locations as well, one in Greeley and then an LTAC in Denver. All right, so everybody looks like they're pretty new to PAM. Okay, great. Well, then we will get right to the heart of the matter on how we can support you guys. All right, how inpatient rehabilitation supports patients with ALS. We're going to talk about optimizing function, safety, and quality of life. Understanding ALS, a progressive neurodivergent disease affecting motor neurons in the brain and spinal cord. This is going to impact three major places. Physical. The condition leads to progressive muscle weakness, decline in mobility, and significant challenges with speech and swallowing. Cognitive preservation. While motor functions decline, cognitive function and sensory nerves often remain fully preserved throughout the disease progression, which truly is something so frustrating for these patients. Care objectives. Holistic care goals prioritize maintaining patient autonomy, ensuring physical safety, and obtaining daily functional comfort.
Now we're going to switch gears and first talk about how inpatient rehab at PAM can help support patients and families in their goal to return to their best quality of life. And this will include several areas, and we're going to cover those next. The first thing I want to point out, when you do come to inpatient rehab at PAM, you will have two different medical groups following you while you're here for inpatient. You'll have physiatry, which is a rehab medical doctor, and then you'll have an internal medicine group that will follow you as well. Then, of course, we have physical therapy, occupational therapy, speech therapy, and that's especially important for those having swallowing issues, and then also communication, because as the vocal cords lose their strength and the facial muscles lose their strength, speech therapy also does training in that as well. They use e-stem and other things to help for speech and swallow. Then, of course, since we are an actual hospital, you will have nurses here 24/7. We also have respiratory therapy here 7 days a week. We have a wound care team. We have psychiatric services available on site. We have in-house lab. We have an in-house pharmacy. So many things that you could also benefit from while you're here for the therapy. And then, of course, as the screen also says, case management is a huge piece of your inpatient stay. We have a large team of all their hospitals, and they can help you add extra services that you might need at home, help find extra help, and just general source of information. Okay, now I want to just touch briefly on benefits that you will receive while you're here for inpatient rehab at PAM. These things, if you've had therapy in your past, you might be aware of, but I just want to point that out, that you will get these things while you're inpatient with PAM. And we can talk about these things in more detail at the end during the question and answer period. But while you're here for inpatient rehab, we will definitely be working on your mobility and transfers. So whether you're having difficulty with bed mobility, positioning, wheelchair transfers, whatever mobility issue you're having, we will work on that here. Secondly, adaptive equipment. That is very important in maintaining your best quality of life at home. So especially OT will work on that with you, because there are many pieces of adaptive equipment that can help as muscles decline and lose strength. This can be adaptive equipment for dressing, eating, in the bathroom, bed mobility. There's all kinds of equipment out there that people might not be aware of, and the OT can definitely help brainstorm what might be best for the person's home. Next, since we do have speech and respiratory therapists at PAM, you can also have both of those services while you're here. Respiratory therapists, of course, help with other things besides just oxygen. They can help on optimizing lung function, breathing techniques, and how you can strengthen your own lungs. And then, as I touched on briefly, speech therapists are trained in swallowing as well as cognition, but swallowing functions are usually first and foremost with anyone suffering from a neurological condition. So speech therapy is a huge piece of the rehab for anyone that's inpatient after a diagnosis of a neurological disorder. Also, while patients are here, their caregivers can have the support of the therapy staff. It is important for the therapist to include caregivers in the training that they're doing with each patient. So if a caregiver wants extra training on how to help a loved one with bed mobility, they can actually participate during the sessions and learn how they can best help and also protect their own back while they're giving support. It can also be other things like positioning education. So how to help someone with the most comfortable positioning, whether that's in bed or a wheelchair. Positioning in a wheelchair is also another thing that you might want educated on while a person is undergoing rehab. So all those things can be done while the patient's here and in the session with their personal therapist. all the sessions will be one-on-one, so there'll be time for questions and education to happen. And of course, the reason why inpatient rehab is important is because we're trying to help each person maintain independence for as long as possible, no matter their diagnosis or where they are. That is the goal of inpatient rehab.
So a nice quarterly tune-up could look like this circle here. First, we're going to reassess. We'll evaluate current strength and functional status. Then we may adjust, update mobility equipment and strategies. Then 3, we'll provide that updated training for family and caregivers. And finally, prevent. Proactive care to avoid this. And that's really the beautiful thing about PAM and the care continuum that we offer. These quarterly tune-ups can be great for both outpatient and inpatient, meaning perhaps, yes, having a big tune-up and coming and staying with us would be great, but perhaps just a little bit more of a touch with our outpatient services while offering all of that same therapy that you saw in the previous slides as well.
Next, impact on quality of life. We've touched on this already briefly, but I think one of the main reasons that a person seeks out inpatient rehab is that they can have 3 hours of therapy 5 days a week. Average length of stay at our hospitals is about 10 days. Some stay longer, some are a little shorter, but during that time, you get intensive rehab in a small amount of time. You can't get that much rehab in any other level of care. You can't get that, with home care or skilled nursing. The 3 hours of therapy really stands out. So that's a huge impact on quality of life and improving independence at home. I think, as we're looking at quality of life, we also think about keeping safe, so preventing falls. With positioning, we want to prevent skin breakdown, risk of swallowing problems and aspiration. So all of those things do affect our quality of life, and that's something that we are focused on for any inpatient at PAM, whether in or outpatient, I should say.
Mm-hmm.
I want to touch briefly about the Medicare coverage with inpatient rehab. Patient wanting to come to PAM, inpatient rehab, we can directly admit from home. And that is unique because for skilled nursing eligibility, you need to have 3 nights in a hospital. But with PAM, inpatient rehab, you do not need that. So for instance, you could call me up today and tell me you're in need of a tune-up. And with traditional Medicare, we could actually have you come today.
One of the things that I think is really amazing about that is you don't have to wait until an emergency or a crisis happens. This is more preventative, this is more awareness. And that goes again saying, if something bad happens, you're staying 3 days in a hospital, that means something bad happened. So getting in front of it is such a great thing that PAM offers.
And then just to kind of revisit what type of patient might be appropriate to come for either in or outpatient. These things on the slide really could qualify a person for either in or outpatient. Of course, if you're wanting 3 hours of therapy a day and you need a physician oversight and other things that we offer for outpatient, that would be a better choice. If you're just wanting to come for PT, OT, or speech, just one therapy, then outpatient might be a better choice. But all these things can be applied whether in or outpatient. We can work on your mobility. If you need equipment, We can train caregivers both in and outpatient, so that can be done both ways. And of course, we can definitely directly admit from home for Medicare. Now, if you have a commercial or managed care insurance, we will do all the work to get authorization. So we will do all that paperwork, and the length of time that it takes for an insurance to decide is about 5 days. So that's not too long of a wait, and we will do all that legwork for you. And then just to double back on what Dustine had mentioned about the quarterly tune-ups, if you have traditional Medicare, that qualifies you for quarterly tune-ups because of a neurological issue. So that would be a planned admission that we could do when you need.
So key takeaways, strategic insights for optimizing patient care and functional independence. First, the inpatient rehab role. Inpatient rehabilitation plays a critical role in comprehensive ALS care management. Our quarterly tune-ups that we're talking about, regularly scheduled interventions help patients stay independent longer throughout the disease progression. Medicare support, as Jen's been saying, Medicare supports those direct admissions for appropriate candidates meeting all of those medical necessity criteria. But then please don't forget, of course, we'll take all of the other insurances. It just takes about 4 to 5 days to get those verified. And then proactive outcomes. Early and proactive rehab leads to better clinical outcomes and improved quality life. And that is it.
It's a wrap.
That is a wrap.
Well, thank you, Jen and Dustine. That was helpful to understand that, there is a rehab facility out there for our folks to, I think the big takeaway I take away is, we always are educating our folks to be proactive in their care. And it sounds like this could be part of that proactivity rather than just kind of being at the mercy of our healthcare system. And when something happens, then we'll deal with it. Let's be proactive and have a better quality of life. So thank you for that. Does anybody have any questions? You can, since it's a smaller group, you can just go ahead and speak if you'd like, or chat or put it in the chat box and we'll read it. Give you time to get your thoughts together. Mark, you're muted. Are you have a question there?
Yes, I do. I'm just wondering if there's a website that is a good source for the information that was shared this morning.
Good question.
I know the answer to that.
Well, obviously our PAM Rehabilitation website, will pop it into the chat in just a second, but Mary will leave you with the presentation, as well as Jennifer and I's contact information, so you certainly can reach out that way. The other two that I just thought of is you can always come and get a tour at our locations, and would be an excellent choice for you. Come and see what the facility looks like and get a sense of the vibe of how our therapists interact with folks, so you can trust how well you're taken care of while you're here.
Yeah,
Different answer to a question, but I think that if you're going to stay for a couple days, 10 days, I think it's important to know and see for yourself how great it is.
Mm-hmm. Good, thank you.
I almost want to take you guys for a tour on my laptop. Like, come walk with me. I'll show you our beautiful equipment, the state-of-the-art gyms, and see how happy our therapists are.
And that's a good point, Dustine. I mean, either of us could meet anyone for a tour. Simple to get a hold of us, and we'll leave our contact information so that you could reach out in the future.
Wonderful, thank you.
Another wonderful asset that PAM does have for inpatient, of course, but outpatient is we have a van that will come and pick you up should you have trouble with getting any sort of transportation to and from physical or to therapy appointments. So that is a great asset that we have. Outpatient that's a little different than inpatient too, is we do take Medicaid and the Denver Health Medicaid options.
Excellent. Excellent. Teresa, you have your hand up. Several hands.
I do. I see doctors at UC Health, and a lot of the services you provide sound very similar, except I get those services as I need them. What differentiates you from that type of situation, and why would I choose to see you rather than continue along the path I'm on?
And I think you're
one thing
talking
that
about
stands,
I think you're talking about the multidisciplinary clinic at university, right? Okay.
Yes.
What's the difference? Very good question.
Yeah, thank you.
I think what stands out to me the most would be the intensive therapy. So the 3 hours of therapy a day out. I'm guessing your multidisciplinary clinic can't provide that, although I'm sure they provide therapy as well as physician
Oversight.
Is that correct?
Yes.
Okay. So you would be able to get 3 hours of therapy along with a medical doctor being on site, as well as respiratory therapists and nursing care while you're here. So a little extra.
So it's not this or that. You can do both.
Right.
Yeah.
Absolutely. That's a good way to say it. Mary.
Yeah.
Mhm.
Great. Good question. Any other questions? No other questions? All right. Well, this presentation is being recorded. So if you want to watch it again and watch the slides again, you can certainly go to our website. It looks like a question popped up. Where are you located again?
We are located in two very convenient locations. One in Golden, where we're sitting right now, and it is near Colorado Mills, very near the Jefferson County Taj. So technically on 6th Avenue and Heritage. Do you guys know where that is?
Yeah.
That area? We call it the Golden location because it is technically in Golden, but it's so conveniently located right there at 6th and I-70 and C-470 all right there. And then our Westminster location, also super convenient off of Highway 36 and Church Ranch Boulevard, also known as 104th, in between Sheridan and Wadsworth. Great location right there across the street from the Butterfly Pavilion and just down the way from the Westminster City Park Rec Center.
Great. Great. Thank you. Thank you for your questions. Any more? All right. Well, Justine and Dustine, thank you for making the time today to be with us, to share this rehab model that can really benefit some people. We just want you to know that that is an option out there if you want to include this type of rehab in your care and planning and being proactive. So, and you said you are on one of the slides. Your information is on one of the slides, your contact information. Is it?
That happened.
You will add that.
Okay, on one of the slides.
Yes, we'll make it really easy for everybody to be able to get a hold of us.
Perfect. Okay.
Thanks, Mary.
All right. Well, thank
Thanks
you.
for
And
having
y'all,
us.
thank you very much and have a good afternoon, everyone. Thank you.
Thank you.
Thanks, you too. Bye-bye.
Bye.